Great afternoon, everybody. Happy Wednesday. My name is Abby Stamp. I'm the Executive Director of the Behavioral Health Resource Network Program for the Oregon Health Authority, and I will be assisting the Tri-Chairs today in running through your presentation and discussion for today's meeting. The Oversight and Accountability Council welcomes and encourages community input. Members of the public are invited to submit public comments and get on our interested parties email list by emailing BURN, which is BHRN, at oha.oregon.gov. Please note that is a new email address since we changed our official name from Measure 110 to the BURN program. That email address and more information about the council can be found on the BURN OAC website. OAC members have asked that OHA staff and other staff who are present in the meeting space introduce themselves in the chat, please. Share your role with the agency, and if you are a subject matter expert, your area of expertise. I will now turn it over to, is it Keisha? For opening remarks. Afternoon, Keisha.
Afternoon. Um, so our agenda will be basically our shared agreements and submittal presentation. And it's a lot of meat to jump in, so I'm gonna pass it over to Carly for attendance.
Thank you, Keisha. Amin.
Here.
Got you. Amy is excused. Carla. Caroline.
Here.
Dharma. Hubert. I know I saw him come in. I'll circle back to Hubert. He may have gotten disconnected. Jackie Mercer.
Here.
Hello. Keisha.
Hello. Here.
Leticia.
Here.
Linda.
Here.
Mason.
Hello, I'm here.
Hey, Mason. Melissa.
Here.
Hi, Melissa.
Yeah.
Morgan. Ryan.
Oh,
Here.
Thank you, Ryan. Did you need to say?
I will wait. I'm so
Okay.
sorry, Kelly. I just totally interrupted.
No worries. Sabrina.
I'm here.
Hi, Sabrina. And Zeb.
I'm here.
Hi, Zeb. Sam will be here, but a little late, and Annalise is excused, and we have quorum with 11. Back to you, Keisha.
All right. So our item is going to be shared agreements, and I'll pass it over to Leticia to get us started.
Sorry, just want to interrupt real quick. We are doing submittable first.
Oh, submittable.
Yes, so we'll go to Kylie.
Good afternoon, everyone. My name is Kylie Cordy. I'm the implementation and development analyst on the Burn team. If I haven't met you yet, it's nice to meet you all. And I will be reviewing Submittable, our new expenditure and quarterly metric data collection software to monitor quarterly reporting. Next slide. Great, thanks. So our agenda today will be reviewing who is on the Burn team currently, providing a platform overview of Submittable, take a look into what our expenditure reporting looks like, as well as staff and provider data, the performance reporting metrics that we're looking at, the impacts of Submittable, and then if you have any outstanding questions, I'm happy to answer. Next slide. So here's our Burn team. So obviously we have Abby Stamp as the executive director, and Sahand, he is our program manager. I am, like I said, the implementation and development lead. We have a full, wonderful group of operations staff from Kathy, Hannah, Carly, Shadrach, Sarah, Taylor, Jason, Nikki, Eileen, and Joe, as well as fantastic grant admins of Ariana, Elizabeth, Katie, Liz, Sydney, and Tim. Next slide. So our submittable large overview. So submittable is the platform OHA is using to collect quarterly expenditure and metric reports from our burns, from our providers. This new reporting framework is intended to improve consistency and data quality, support compliance, monitoring, and make it easier for staff and grantees to submit and review reports. Over time, this system will help OHA and our burn program team better understand service delivery, summarize program outcomes in a clear and accessible way. Next slide. So our reporting guidelines, just for an overview, are that we reports are due within 30 days of the quarter's end. Grantees have access to tools that are provided to support with their adding of data to submittable. We have a quarterly burn template where folks can use an Excel spreadsheet to kind of help take the information that they're collecting on the ground and then transfer it to submittable if they choose to do so. Providers are able to put in narrative explanation. They report on the full quarter, and we're ensuring that no client level data or information is being reported within submittable. So this is not where that goes. So grantees can expect ongoing support from their grant administrators and the burn operations team as they get used to submittable's reporting features. This is all new for everybody, and we have been well received by our grantees throughout this process, as it is a little bit of a learning curve for both parties. But the feedback that we've gotten is that grantees are actually really happy with the ease of use when submitting into the submittable platform. So we are looking for increased opportunities to share this feedback on both reporting metrics and the software itself. And this will be ongoing so we can make sure that we're delivering the best product for our grantees as we can. And Submittable is maintained by OHA's Compass team, who has hosted webinars in the past and will continue to provide technical assistance for any of our grantees who need additional support. And if you do need any additional support, please contact Sean McMahon, and his email status is right there, and that's on the Compass team. Next, I'll go into expenditure reporting. So how do we, grant administrators and the burn team, review expenditure spending? Next slide. So grant admins review each provider's scope of work, milestones, and expenditures for each service area. So we have screening, assessment, low barrier SED, peer support services, housing, and harm reduction. Grant admins will ensure that spending is in alignment with grant activities and proper oversight is occurring through these 6 service areas. Next slide. So within that, we have 5 subcategories per each service area. These 5 budget categories could include several things, but they are personnel, services and supplies, training, vehicles, and administrative costs. Each of these categories has these corresponding line item subcategories that each provider contributed during the grant agreement process. So we have a better understanding of what each grantee is spending in these 5 subcategories to help us, whether that's direct or indirect service personnel, trading costs, conferences, gas and mileage, rent, all of those important things. Next. This is a glimpse into what the tracking looks like, or the submittable form when a provider comes in and puts in information. So this screenshot collects quarterly spending data from our providers, and we ensure that the spending is aligned with those approved service areas and activities that were walked out in the grant agreement. So folks would come in here, put the cost of, say they spent, I don't know, $5,000 on mileage and gas for that quarter. They're going to put that dollar amount in that first or that 4th column. And then if there needs to be a narrative, they can contribute that. It's very helpful, by the way, when folks do contribute a narrative, because grant admins get a little bit more insight into how it's spending, and how it's working. Next. So staff and provider data. How does the burn team review investments in providers? So this is where we start to look at direct client staff and non-direct service admin staff. So this screenshot captures what the submittable form would look like for the multiple types of personnel that one could be covering through their FTE expenditure line items. So the folks that support people directly are direct client staff, like a personal support or a peer support worker, CADC 1 and 2, certified recovery mentor. And then non-direct service admin would be like an executive director or a burn manager or a grants manager, somebody who's not directly working with staff. However, we know that some organizations have staff responsible for both direct and administrative work. And in these cases, we are providing technical advice and giving assistance to encourage that any personnel doing any direct service to be counted as such within these metrics. Next slide. So the last thing we're capturing is performance reporting. So how does the burn team review performance metrics? Next slide. So we are capturing performance metrics. So this is separate from what the expense is related to this. We want to see our providers culturally, linguistically, specific service providers. Are these folks doing outreach in specific locations and are providing a certain type of outreach? How are we capturing these metrics? And so we have several areas, one being personnel, one being service metrics, one being outreach, and then the other is narratives to kind of get a full holistic picture of how the provider is doing and if they need any of our technical assistance to help support them. This next slide is what the culturally and linguistically specific service category looks like right now. So the OAC, obviously, during all of our during the pre-award phase, when we are accepting applications and looking all of that, this is one of the priorities in determining who was funded in this round that we have currently. And so we look at this to make sure that the folks who have claimed that they are culturally and linguistically specific service providers are in fact providing those services. Next, please. Carly, can you go
Oh,
over?
sorry, I brought up that second part. Did you already go over that part?
This
Okay.
is also attached to the OAR, which is within the it is shown in submittable as well. So it has the language there. And so we are looking to, capture all of that information and make sure that we know that you're providing those services based off of your application. The next is the service metrics. So telehealth and denials. The telehealth metrics show how burns expand access, especially in rural or hard to reach arenas. And denial data helps identify common barriers and gaps in available services. These service metrics intend to encourage communication and referral within each burn network, promote collaboration across providers to connect people with the right care, and focus on improving coordination and not penalizing providers. Next slide, please. So engagement. This is where we are seeking how many individuals are engaging with the burn, how many clients are needing assessment, how many clients are you providing harm reduction services to, how many clients do you work with this quarter, and have you been re-engaged with, 3+ times throughout. And we are using this information, but are also asking for no personal or unique client information. If you have that and you're facilitating one of these, that is a Rhodes platform, which is separate from Submittable. So for here, we do not want any personally identifiable information. This is just to support OHA's understanding of folks who have been brought into an organization through provider engagement, and are accessing burn funds services due to these outreach strategies. And the last metric that we're looking at are the narratives. So what are our success stories, our challenges? What's the context? So if providers need explanations or updates that help clarify data, or describe local circumstances that maybe aren't captured in the metrics, how can we gain further insight into being a better partner? And then media and marketing. There's a new space in Submittable. Well, it's not new, it was built in, but for folks to upload a Vimeo link or marketing materials, or maybe you created a one pager of success stories or an event that you're going to. And so there's an area for you to share with us different attachments, different media that you're really proud of. We hope to amplify and uplift and highlight all the wonderful things that you all are doing. And so this really gives us a good position to do so. And it also, if you're identifying challenges, we would also like to help support that and make your 4-year grant experience much smoother, if we can. So we can move to the next one. There is a Save Lives Oregon training that's open to the public tomorrow. We are looking to have a more burn specific one. And so I hope to be able to share that information with you when it becomes available in future meetings. Here we can go back to submittable impacts. Thank you, Carly. So just to, wrap everything up, submittables impacts are to create this centralized system, new reporting framework intended to improve our consistency and data quality, support compliance and performance monitoring, and make it easier for staff and grantees to submit and review reports. Over time, this system will definitely help OHA better understand service delivery and summarize program outcomes in a clear and accessible way, as said before. We want to promote that consistent reporting format using standardized metrics, allowing OHA to track the submissions and the follow-up, as well as data, supporting that, getting faster at reviewing and helping to correct any errors, as well as propose any changes to the legislature or rules based upon provider and burn feedback. And then build a clearer picture of each service area and the resources and how that money is being used across the state. And if you would like to further contact us about anything around Submittable, you can email the burn inbox, which Abby just talked about, or burn.grants@odhsoha.oregon.gov. If you have any particular technical questions for the Compass team, that would be Sean McMahon. And then Save Live Oregon, which provides a multitude of resources. Their email is there too at info@savelivesoregon.org. That is it for me, unless anybody has any questions or would like to speak about things differently. Questions, comments, concerns?
Kylie, thanks for going over the overview. From a kind of a high level takeaway, the team has been working really hard internally with our analyst partners and our IT partners to getting this up and running. We did some trainings back in June. Earlier this year, we did some trainings for burn providers, so that folks would understand and be familiar with the system that they'll be entering their expenditure and performance metrics into. And folks have been able to reach out to their individual grant administrators to do some follow-up technical assistance. But thank you, Kylie, for putting together an overview of this whole system that we launched. We launched for quarter one, so we are a quarter in, and Most of the grantees have submitted their information, and we're in the process of collecting, culling, organizing, and taking a closer look.
We got a question in the chat from Mason.
Oh, I pre-answered Mason's question. Yes, Submittable was rolled out starting July 1st, when the grant cycle 2 began. Go ahead, Linda.
This is really fantastic. I'm really excited to see that the data quality will be better, and I think that can be really helpful with future funding cycles. I was wondering, what is the plan for sharing some of this data? Yeah.
That's a great question. Kylie, do you want me to answer that?
Dan?
Okay, I'll go for it, and then you can fill in the gaps I leave. So as a reminder, there are two data systems. So we just went over Submittable, which is money and aggregate information and other client counts like outreach and harm reduction, right? Then we've got roads, and roads is the client or patient specific encounter system that the rest of the state uses that we are rolling out with burn providers in two ways, either through existing electronic health record connections or through a portal. It's also available in the cloud. And we're Compass, which are our IT partners, are rolling out those trainings right now. And over the next probably 4, 6, and 8 months, providers will be trained and onboarded and begin to use roads. So we've got the client information, we've got the aggregate and the expenditure information. And so just as another comment, the client portal using roads is much more like, case notes and what happened and what burn funded services were provided for each individual. And so in a year-ish, when both of the systems are really up and running, we're going to be able to collect both, analyze and synthesize both systems, and then we'll be reporting it through a publicly available dashboard. And then we're in the process of building out now the Submittable because we have that data already coming in, and figuring out how we weave that all together, and wanting to respond to community, OAC, governor, legislative desires. What is the return on investment of burn grants? What are the treatment outcomes? What are the housing outcomes? And then we'll be able to actually make the connection between what services were provided, contacts made, and the outcomes around wellness and safety and recovery and all of those good things. So that it'll be a publicly available dashboard. That is the short answer, but that's also the background too, Linda. Sabrina?
I'm not sure. Oh, okay, you just answered Caroline's question. I was wondering, we might not be quite there quite yet, but I was wondering what we're going to be doing or what it might be look like for the future concerns, questions, or complaints for burn providers. I know previously there was a form that was created that people that had concerns could submit it, and then it would be tracked, and then if needed, the OAC would be looped in. I was wondering what that process is going to look like now, and what's going to happen to the current concerns or complaints that might be in that email box or wherever they go to.
I believe, and Carly can correct me if I'm wrong, that is still up and running, that QR code that gets people to an access page. And Sabrina, when concerns and comments come in, we address those immediately. So there is no backlog or list of comments or concerns that we have not addressed yet.
I would recommend, though, if you do have or come into a situation, I would reach out to your grant administrator first. If it's not like a technical thing, like I can't log on or something, that's definitely a Compass IT question. But if it is around, how do you think I should capture this information, or do you think I'm inputting this information in the correct way? We have reference guides and data dictionaries, but still, it's complex. There's a lot of overlap, and we all are trying the best we can. So if you ever run into anything like that, I recommend reaching out to your grant administrator to help support that conversation.
Thanks, Kylie. And I was referring to Any concerns about the use of burn dollars, kind of that more general, and Kylie's that this is really helpful for particularly for grantees of technical questions about I'm opening the system and I've questions and concerns about how I get the information in appropriately. We're building all sorts of technical assistance for it. Hi, Caroline. Hi. Your hand, I did not see it. I am so sorry.
I know, that's why I tilted it. So,
Appreciate it.
Abby, I just would recommend that you meet with Julie as soon as possible to see how we're going to be working with the tribes. Our next OICA meeting is on December 8th in Portland, but I would recommend that I don't know, has Julie been involved with this process? I mean, has she seen?
So all of the submittable information and the roads, those are only for the 234 grants that you all approved earlier this year, not for any of the tribal agreements. Data submission is not required through those agreements.
Oh, okay, I still think we probably need to have a discussion because I think we do need to start capturing some data.
Okay.
But
Yeah, I meet regularly with Julie and Carissa, and they know about this. And Carissa has developing a plan for the tribes to fill out about how they're going to use the dollars and kind of what the goals are and the objectives and to complete that information. But yeah, I'll recircle back at our next check-in. Thanks, Caroline. Any other questions? Well, again, Kylie, thank you. I appreciate you putting all that information together. Great. If other questions come up later, holler and let us know, and happy to answer them. Thank you. Keisha?
All right. Sorry about that. I got the submittable and shared agreements mixed up. But now we will now move to finalizing our shared agreements. We will review the micro board created at our last meeting and then move to discussing and finalizing the agreements. We will discuss each statement separately, focusing on intent and wordsmithing. We will form consensus before moving to the next statement. And once all statements have been discussed, we will vote to adopt the finalized shared agreements. And so I'm going to turn it over to Zeb and to Carly.
Sorry. Couldn't find the unmute button there. But I get the joys of going first. All right. Yeah. Here we go. So let's see. Bear with me. I got a couple of different screens going on, so I'm gonna have to bounce back and forth here, but we're gonna take a look at these shared agreements. So we had kind of a brief overview there. We're gonna go over the Miro board recap. We're gonna individually review each Miro board section. Shared agreements, finalization process, consensus model walkthrough, build a shared agreement, vote on adoption of shared agreements, and then moving forward, implementation and accountability. And then 8 says parking lots. So I am on to slide 3. So slide 3 is a recap from a previous meeting we had, when you guys remember this one, where we went ahead and shared our thoughts and feelings about how we want things to look going forward. And we're going to get more in depth in this as the slide goes on. But this is just to remind everybody the work that we've done so far. So I don't need to read each one of these sticky notes because we're going to be going over it, starting with the next slide here. Just one second. So tension was one of those sticky notes. So what would you like to see the committee practice as a group when members disagree? And that was the topic. And what we had said was positive intent, respectful, no name calling, no talking over each other, raise hands, shared accountability, high standards, intent versus impact, lean in, lean back. So that was for tension. For needs, the topic was like, what do we need from this group to feel respected, heard, and valued? And we came up with an opportunity to build rapport with everyone to gain trust. Trust that we understand our individual communities, trust all by itself, active listening, being shown that what we share is understood with everybody, and to not be dismissed simply because our experiences may not be the same. Validation, talk things through, process thoughts in a shared space. Acknowledgement, that's verbal and nonverbal. Understanding we are not always the experts, listening to those who have had experience. Shared accountability and high standards, preparing ahead, showing up on time, etc. And then we come to expectations. So what are our expectations of one another? And this is what we came up with at that last meeting that we did this. Peer and or staff check-ins after tension conflicts during meetings. Respect boundaries, express boundaries explicitly. Understand that everyone engages differently. Disagree with the idea, not the person. Question content versus the person. Respect individual access needs, not rebutting things that are not your experience, honoring folks' experience. Participate with intention, actively listening, contributing when relevant, and making space for others. Believe participation is about quality. And now I will hand over to Leticia.
Thank you, Zeb. All right, so we will move on to engagement now. So engagement, what helps you stay engaged when conversations are complex or challenging? Share the mic, opportunity for checking in during the discussion, co-chair report out at the beginning of the OAC meetings, synopsis after the complex portions, dedicated Q&A portion of the meeting in between technical conversations, calls to action, and finally, visual aids. Okay, next slide. All right, community garden. So what do we want to take note of and visit at future meetings? Determine official space for parking lot. So who owns and who manages that space? Group exercise. What are people's learning styles and or access needs? Co-chair report out. Should or how do we operationalize it? And finally, develop interim intervention plan between now and 2026. Okay, next slide. All right, so I just want to emphasize this is a draft of our shared agreements. So I'm going to go through them one at a time, each one of the sticky notes here. So trust in each other. Assume good intent. Lean in and lean back. Trust that staff will step in if shared agreements are being broken. Honor folks' experience even if you don't understand. Strive to achieve everyone's access needs. One voice at a time. Share the mic equitably. Speak from your own experience. Trust folks' lived experience. And finally, bridge from one meeting to the next. Review materials collectively to set everyone up for success and provide continuity. Okay, next slide. Okay, so I'm going to walk through the process that the OAC we're going to use today to finalize the agreements. Okay, so first discussion. Tri-chair reads individual shared agreement. Then members raise hands. And tri-chair calls on each member in order of hand raised and discuss each item individually, discussing with intent and wordsmithing. Next, we will move into consensus. So a member will suggest shared agreement and ask for objections. If objected, we move back to discussion until consensus is reached. And here we're going to utilize silence equals acceptance. And then we will move to the next shared agreement or the final vote. And finally, the final vote. Tri-chair reads final agreement and OHA shares final draft on the screen. Next, member makes motion to adopt shared agreements. Member seconds. And finally, OHA conducts a roll call vote. Okay, next slide. Okay, so our next slide, decision-making by consensus. So again, just to reiterate, so we'll first start with the discussion. Member raise hands. Tri-chair calls on each member in order of raised hands, followed by proposal. The member suggests proposed language. Member asks for objections. Again, silence equals acceptance. And if objected, objecting member states objection and the council moves back to the discussion. Finally, consensus. Consensus is reached when there are no objections. Okay, and I just want to take a moment to see if there's any questions here. And I can't see everyone.
I don't see any hands raised.
Okay, thank you, Carly. Okay, so then let's move to the next slide. All right, so now we're going to go through each shared agreement individually using the process that we just discussed. All right, trust in each other. Carly, if there's raised hands, will you be able to see them?
Yes, I can now. Linda has her hand raised.
Okay, Linda?
Oh, I noticed that this one seemed, maybe I should actually wait till the other one comes up, but it seemed very similar to one of the other ones. So I was wondering about combining them. But overall, I like them.
Would you have proposed language that you'd want to use here, Linda, if we were to combine them?
Yeah, sorry. Why don't I share once we get to the other one? Because yeah, I can't see it here. So I'll think of some once we get to the other one.
Okay, thank you, Linda. And I can't see the hands again. So Carly, do you see any raised hands?
No raised hands.
Okay, so I will now pass it over to Keisha for vote.
Oh, I'm sorry.
Is that at the end I'm doing it, or do I do it?
Yes, we'll go through
Okay.
each individual agreement. I'll bring them up, and then once consensus is formed on each statement, we'll move to the next one.
Okay, thank you.
Of course.
So can we move on to the next statement? Thanks, Carly.
Yes. There we go.
All right, our next shared agreement is assume good intent.
And I do not see any hands.
Okay, so we will move on to our next shared agreement.
Just so that for clarity reasons, if we want to confirm that there's no objections before moving on.
Oh, yes. All right, can I confirm that there's no objections before we move on?
I see no hands.
Okay. Wonderful. Next. Okay, our next shared agreement is one voice at a time. Equitably share the mic.
I don't see hands.
Okay, any objections before we move on to our next shared agreement?
Don't see any.
Okay, next shared agreement. All right, lean in back when necessary.
No hands.
Okay, again, any objections before we move on to the next shared agreement? Okay, next we have speak from your own experience, trust folks' lived experience.
No hands.
Okay.
Oh,
Any,
Linda has her hand raised.
oh, go ahead, Linda. Thank you.
Oh, I think this, although I thought this was kind of repetitive of number one, but I realize it is kind of different. So I guess I was wondering if it should be like trusting each other and folks' lived experience so that that trust is like all one theme.
Mm-hmm. Okay, so thank you, Linda. I guess what we'll do now is we'll open it up for discussion and see if anybody else has any input. So the proposed shared agreement would be trust in each other and folks' lived experience.
Mason got a hand raised, and then I got my hand raised.
Okay, sorry. Go ahead, Mason.
Well, I think the only main distinction would be one is to trust in another's lived experience, and the other being to only be speaking from one's own lived experience, like as in, like don't not projecting the experience of another. So I can see the distinction there, and it could be valuable to have both.
Okay, thank you, Mason.
Mhm.
Me?
Keisha.
So I'm kind of with Mason on that. I think they're saying two different things to me. I think they should remain separate.
I'm totally okay leaving it as is. I was just on first pass noticing the similar words, but hearing that, I think it makes sense as is.
Okay, thank you, Linda. Thank you for everyone's feedback. So just before we move forward, it sounds like we're going to keep them separate. So trust in each other will be one shared agreement, and speak from your own experience, trust folks' lived experience will be another shared agreement. Okay, I'll take the silence as consensus. So if there's no objection, we'll move on to the next shared agreement. Okay. All right, next we have honor folks' experience, even if you don't understand. And thank you, Carly. I figured out how to see all the participants.
Okay.
Thank you.
Mhm.
All right, Mason. Oh, Mason, is your hand up?
Oh yeah, yes it is. That one maybe is redundant to what we were just talking about. Like honoring folks' experiences is, trusting other folks' experience
Mm-hmm.
feels like the same thing to me, but I'm open to other ideas.
Thank you, Mason. Okay, so we'll move that back into discussion. And I'm open to hearing what everyone has to say.
Oh, sorry, that's me, Keisha. I don't see any hands
Go
yet.
ahead, Keisha, and then Sabrina.
Okay. Yeah, for me, I don't know. I'm just kind of finicky, and it seems kind of two layered. Like, speak from your own experience is, one thing. We can have a discussion. You speak from your own experience, and then we move on to further discussion and honoring folks' experience instead of trying to argue them down about what their experience is. I don't know. It's kind of two different things to me, but you know, I can refer back to other people understanding.
Okay, thank you, Keisha. So I'm hearing you say you'd like to keep those shared agreements separate. Okay, Sabrina?
In the way that I'm reading it, I almost like speak from your own experience as one, and then honor folks' experience even if you don't understand slash trust folks' lived experience. It seems to me like that might be a better fit, or even all three separate, but
Okay, if we were to make a change, does anyone have proposed language?
Yeah, I like Sabrina's suggestion, and I think it also addresses Mason and Lakeisha's concerns that we're still including it all, but just organizing it more clearly. So it would be speak from your own experience, and then the second one would be maybe like trust folks' lived experience slash honor folks' experience, even if you don't understand.
Okay, thank you, Linda. Carly, because we have proposed language for a change, would we move into a vote at this time?
No, we can still go off of consensus and we'll edit
Okay.
it live and vote at the when we
final.
finalize, yes.
Okay.
But we still want whoever proposed that language to state the language clearly and then ask if there are any objections before moving on.
Okay, thank you. Linda, would you state that clearly, or you're also welcome to put it in the chat?
Yeah, I'll type it in the chat.
Thank you.
I'm just wondering, are we breaking it down in 2 or 3 or?
I think it's two. Hi, Keisha. I think it's 2. I'm just, okay, there we go. So Linda is proposing that we break it into 2. The language would be, the first would be speak from your own experience as its own agreement.
Sorry, the parentheses are just
Okay.
Yeah,
That's right. I gotcha. Thank you. So the first would be speak from your own experience. And the second would be trust folks' lived experience, honor folks' experience, even if you don't understand. Are there any objections to this change?
So is that, I think I got confused. Did you combine trust folks' lived experience and honor folks' experience? Because you don't have to trust folks' lived experience to honor it. You can still, have your disagreements, but digress.
Okay, I see something in the chat from Taylor. So if this is helpful to simplify it, what about honor and trust folks' lived experience, even if you don't understand?
Me, it's still two different things. Because you can honor someone without trusting them. You can digress and honor what they say, even if you don't clearly, I don't know.
Sorry, Keisha, are you objecting to the change?
Combining them? Yeah. I would break it down into the 3. Speak from your own experience, trust folks' lived experience, and honor folks' experience, even if you don't understand it, in 3 bullets.
Okay, so we have one objection to Linda's suggested change. Keisha, do you want to put yours in the chat or just
I can just state it, breaking those 2 into 3.
Okay.
standalone bullet points. So one would be speak from your own experience, trust folks' lived experience. Wait,
Mhm.
yeah. Wait, now I spell my. Okay. Speak from your own experience, one bullet point. Trust folks' lived experience. Two, and honor folks' experience, even if you don't understand it. It's the third. I would just break them up into three.
Thank you, Keisha. Does anyone object Keisha's changes? Okay, seeing no hands up, we'll move on to the next shared agreement. Or no, Abby, got Abby in the chat. Oh, thank you, Abby. So Keisha's suggestion would be speak from your own experience, trust folks' lived experience, and finally honor folks' experience if you don't understand. So it would break the last two into 3 shared agreements. See no objections, we can move forward. Okay, next shared agreement is strive to achieve everyone's access needs. Abby, okay, typo on the last one, sorry, should be honor folks' experience even if you don't understand. Thank you, Abby. Okay, see no hands raised for this last shared agreement. Are there any objections before we move on to the next shared agreement? Okay, can we move on to the next one? All right, next shared agreement. Bridge from one member to another to collectively set everyone up for success and provide continuity. Okay, see no hands. Are there any objections to this shared agreement? Yes, Mason? Mason, I see that your hand is raised. Oh, it shows you're not muted, but I can't hear you. Thanks, Mason. Mason, do you not understand the last shared agreement? Okay, language could be made more explicit. Bridge meetings could be. Okay, so to be okay, could be to be summarized from last meeting, changes made, decisions, etc. Okay, we can move this back into discussion. Mason, would you be willing to put in the chat the exact language that you would want to use on this shared agreement? Your proposed language? Thank you. Sabrina, I'm just going to wait and see Mason's language on it, and then I'll call on you next. Okay, so Mason is proposing that we change the language on that last shared agreement to each meeting will have a summary of previous meetings, discussions, and decisions to promote continuity. Are there any objections to this change? Sabrina, I see your hand up.
I think I'm going in the same lines along with Mason, except for are we trying to say prepare for each meeting or set aside time to, for a summary of previous meetings? Sorry, the chat just moved. And that's what I'm just trying to hone in on. Are we preparing for each meeting? Are we setting time aside to make sure that we're studying the materials and discussions and decisions to promote continuity, or am I off the marker?
Thanks, Sabrina. Mason, I see that you added set aside time. Oh, there we go. Thank you. Set aside time at the beginning of the meeting for a review of the last meeting's decisions and discussions. Okay, so if I'm reading this correctly, oh, I see another one. It would be set aside time at the beginning of each meeting for review of the last meeting's decisions and discussions. Is that right? Okay. Okay, Mason, your hand is still up. I don't see any other hands. Is there objection to Mason's suggestion for change of language? You're okay, Mason. And then I'm going to put it in the chat, I think. Set aside case. And I don't see any objections. I'm just going to put it in the chat so everyone can see it. Mason, does that look accurate? Okay. Okay. So now the proposed language is in the chat. Are there any objections to that proposed change? Okay, see no hands. We'll move on to the next shared agreement, the final one. Okay, trust that staff will step in if shared agreements are being broken. All right, and see no hands at this time to make changes to that. Are there any objections to that last shared agreement? Okay, see no hands. Now I will pass it on to Keisha to vote.
Not yet. Thank you. So we have captured some additional items, and we want to see if you want to add these into the shared agreements or not. And I'll go through these and go through the same consensus that Leticia just went through. So the first one is active listening. Do we want to add that to our shared agreements or not? Sabrina?
I'm guilty of not always 100% actively listening. I'm in favor, but I'm in favor of it.
Yeah.
Yeah, I agree with that. I agree with that too.
So we're going to add it to the shared agreements. Um, okay. All right. So if I have no objections of adding active listening to the shared agreements, we will add it. Any objections? Okay. Do we have any objections to adding 100% intentional participation? Do we have any objections to adding that?
I don't see any hand. Oh, Linda has a hand up.
Um, I guess if someone can clarify, I don't, I guess 100% know what that means.
Yeah, I was gonna tap into that too. 100% is a high bar, and like who decides what that means? I'm not sure. Do we have somebody to kind of tap into that one? Abby?
If I remember correctly, I think where some of this came from was sometimes OAC members are so dedicated and committed to this meeting that they end up having to multitask during the meetings. And then that can be challenging when we don't know who is present because they have other pressures. And when we have to have folks vote, then we need to make sure that folks are able to participate and listen to the whole discussion so that that vote is well informed.
Thanks, Sabby. That's helpful. I guess to me, it seems like that is kind of included under active listening then. So I guess I would say I don't think we need to add it since active listening is kind of saying that people should try to intentionally participate.
Yeah. Or even wordsmith in the language to say 100% intentional participation when we have to vote or something. I don't know. Or just take it. I don't know. So Linda had a suggestion. Any more discussion? Leticia.
I would agree with Linda, removing the 100% intentional participation and just leaving active listening.
Okay. So Dharma?
I think the voting piece feels important though. I feel like it would be a separate like item maybe. It's like I believe like the active listening piece. I'm with you on that. I'm thinking we could add something like ensuring like you're understanding votes before participating, or I'm not sure. Or ensuring you're committed to understanding the votes as we're making them.
That's good too. Zeb. And
Yeah,
Dharma,
I like what
I'm sorry.
Dharma said because I think
Yeah,
active listening covers a lot of things, but making sure everybody's well informed when they're voting on stuff or paying attention. Um, you know, when we are voting, that they are well informed on what they're voting about. Because I think we've all experienced over the course of the past 4 years, we've discussed stuff, and then at some points people would vote yes, and then retroactively go back. So just staying well informed.
I'm wondering, Dharma, do you have some proposed language for that, or Zeb?
Dharma, you want to take a shot at that? I think you had
Ensure,
the words that
ens-
were good.
I put something in the
ens-
chat, but I'm not sure about it.
so Dharma, put in the chat, ensuring you understand
Oh,
and are informed before voting.
okay. That looks good.
I can get behind that. Is there any more discussion around changing the proposed language to ensuring you understand and are informed before voting? Do we have any objections? All right, new language. So we're gonna move forward with what Dharma put in the chat. All right, the next one. Is anybody opposed to do not talk over other members being included in the shared agreements? All right. Linda.
I'm sorry, apparently I have a lot of opinions on this, but I think this is included in one of the previous shared agreements. No, like something about one voice at a time. I guess my other thought is this is something we go over at the beginning of every meeting, right? Is that the intention? And so I guess I'm also thinking about not wanting it to be super long because then each item, I think, kind of loses like weight.
Okay. So is that all the discussion? All right. So is anyone opposed to us dropping this agreement? All right. The next one, disagree with the idea, not the person. Anybody opposed to this being added to the shared agreements? Hearing nothing, seeing nothing. We will add this to the shared agreements. Now this one, trust each other. Is anybody opposed to adding this to the shared agreements?
Yeah, what Mason said, I think we have, isn't the first shared agreement trust in each other?
Yep. All right. Is anybody opposed to us dropping this, adding this to the shared agreements? All right, hearing none, we will not add this to the shared agreements. All right, the next one, center those most impacted by the war on drugs. Is anybody opposed to adding this to the shared agreements? Right. Hearing none, no opposition, this will be added to the shared agreements. The next one, spirit of collaboration with OHA. Is anybody opposed to adding this to the shared agreements? All right, hearing no opposition, we will add this to the shared agreements. The next one, shared accountability, high standards. Anybody opposed to adding this to the shared agreements? Hearing none, we will add this to the shared agreements. And last but not least, promote continuous learning and self-reflection. Is anybody opposed to adding this to the shared agreements? All right. This will be added to the shared agreements.
Keisha, give me one moment to pull up the final slide.
Yeah. And then I'll read off your slide.
It should be good to go now, Carly.
I think I might have to stop sharing and then share again. One moment. Okay. Let me get there.
Sorry, real quick, did we lose quorum?
We should not have, but let me double check. Nope, we are good with quorum. And let me bring those up real quick.
All right. The Burn Oversight and Accountability Council shared agreements. I'm going to read over this final document.
That's so something's
Yeah,
that's
something's not
picking
working.
up the light. Yeah, that's not picking up the edits.
Jason, do you want to share your screen?
Yes, I can do that.
Okay.
Maybe.
Sorry, Keisha, the edits aren't transferring over to my slides.
Okay.
Sorry, just 1 second here. There we go. All right, sorry. Is that working?
Yeah, it's up there.
Okay. But it's not in the view. Is it showing full screen? It was in full screen mode, and then I think it came out. Sorry. There we go. Is that right?
Yeah, it's good now.
Okay.
I'm gonna run through this final list of the Burn Oversight and Accountability Council shared agreements. Do I need to? Oh no, sorry. Lost my notes for this. Right. So, trust in each other, assume good intent, one voice at a time, equitably share the mic, lean in and back when necessary, trust folks' lived experience, honor folks' experience even if you don't understand, speak from your own experience, Strive to achieve everyone's access needs. Set aside time at the beginning of each meeting for a review of the last meeting's decisions and discussions. Trust that staff will step in if shared agreements are being broken. Active listening. Ensure you understand and are informed before voting. Disagree with the idea, not the person. Center those most impacted by the war on drugs. Spirit of collaboration with OHA. Shared accountability and high standards. Promote continuous learning and self-reflection. Is everybody in agreement with these shared agreements? No discussions, no changes? Mhm. So I'm gonna make a motion to adopt. I move to adopt the OAC shared agreements as shown in slide 14 with an effective date of January 1st, 2026.
I second.
You opposed? So I think I pass it to Carly for official vote.
Thank you, Keisha. Jason, you can stop sharing and I will go through the vote. Ami, how do you vote? She may have actually stepped out. Caroline?
Yes.
Thank you. Dharma?
Yes.
Hubert? Jackie? Jackie, you can put it in the chat too. Oh, there you are.
Okay, yeah, I'm hearing yes, I vote yes.
Thank you.
Thank you.
Leticia?
Yes.
Thank you. Keisha, I skipped you. What do you vote? Or what is your vote?
Yes.
Thank you. Linda?
Yes.
Mason? Oh, you can put it in the chat because your mic isn't working. And Amy, I did see you step in. I'll circle back around to you. Thank you, Mason. Melissa?
Yes.
Thank you.
Thank
Ryan?
you. Ryan?
Yes.
Thank you. Sabrina?
Yes.
And Zeb?
Yes.
And Amy?
Oh, there. What am I voting on? Tell me again, real quick. Just a quick shot.
Adopting the shared agreements.
Okay, then yes. If everybody's saying yes, yes.
Thank you. That passes with 12. And give me one moment and I will bring up the remainder of the slides.
Okay.
Ah.
And I can see him too.
Come on.
You want me to just go for my slides? It's just not visual though.
Yeah, I think I can. I've got it here. Here we go. There we go. Is that up?
There we go.
Now it is.
Perfect.
All right. And this is the last part. Moving forward, implementation will be effective January 1st, 2026. But you are encouraged to begin practicing these shared agreements immediately. Accountability when an agreement is broken. Why? To uphold a culture of mutual accountability and respect for shared agreement. When? Immediately after shared agreement is broken. Who? OAC chairs, facilitator, OHA, and OAC members. Verbal reminder in meeting to abide by shared agreements and redirect discussion. Outside meeting with OHA if necessary, and after multiple offenses will be elevated to OHA leadership. And I think, and sorry, went off. And parking lot. Parking lot items will be incorporated into the council's charter in 2026 and or addressed at future meetings. Co-chair report out at OAC meetings, agenda item, access needs and learning styles, peer or staff check-ins after tension or conflict during meetings, more visual aids, synopsis after complex portions of the meeting, maintain protections for trans healthcare, dedicated Q&A portion of OAC meetings, check-in opportunities during the discussions, and opportunities to build rapport and trust between the OAC members. So those are some things that were in the parking lot that we will move into in 2026. Sorry, toggling screens. All right, I think, are there any final questions, discussions, or we can give you some time back?
Oh, I do see Sabrina's hand.
Thank you. I had a question about the second to the last slide that Keisha presented. And I was wondering when it says the person will be held accountable verbally, in the meeting. And then also after multiple offenses or multiple times of doing it, that the person will be addressed possibly by OHA leadership. I wanted to know if sometime in that process, if the council member would have some type of mediation or advocacy for that person, say a group of people thought the person was doing it this way, the individual that is in question doesn't see it from that point of view. Is there some kind of resolve, or is it just one way or the other?
Sabrina, I would love to have a conversation with you about that and get some ideas and maybe come up with a plan and process for that.
Okay, thank you very much.
Of course. I'll call you after this, or you can give me a call and let me know when works for you.
Thank you for that. Seeing no hands, nothing in the chat. We are adjourned. We're closing out. See you guys next time. Thanks to the tri-chairs for the joint effort, and see you guys later.
See you guys.